All right, it looks like we are live now, so it's 4:01. So we're going to go ahead and get started here. Thank you to everyone that was able to join us. My name is Matt Offlick. I'm the Community Relations Manager for the Seattle Office of Emergency Management. We're just going to take some time today to talk about really summer preparedness, so focusing on the potential for extreme heat and wildfire smoke, but also talk about the ongoing impacts from COVID-19 and how that really kind of affects some of our guidance around extreme heat and wildfire smoke. You should see a Q&A option. So I'm welcoming people to put questions in as we go. I'll probably try to take a break a couple different places throughout the presentation and address some of those questions. There's a few of our OEM staff that are kind of working in the background here to manage the PowerPoint and take some of those questions. So they'll try to stay on the questions coming in. And if there's something that seems kind of pressing and relevant to what I'm talking about at the moment, then maybe we'll try to address it right there. You should see already in the Q&A box some links that were sent out. So one is a link to a copy of this PowerPoint, so you have that. And then the other is a link to a resource document. So a lot of the things that I'll mention today are just listed on that PDF and have links directly to them, so you have that information. So with that, we'll go ahead and get started. I'm going to talk some about just kind of the hazards that we could be impacted by. I'm going to talk about really what the kind of city perspective is from like a city response and planning standpoint, and then also kind of talk about that personal preparedness side and things that people can be doing for these events. Get the next slide, Tay. So here is the list of all of the things that concern us. This comes out of our Seattle Hazard Identification and Vulnerability Analysis, which is one of kind of the core documents that OEM puts together and really serves as a basis for all of the planning that we do. That really lists all of the things that could happen that concern us. To really simplify it, we do rank them, and what we do is we're really looking at kind of a couple of different factors, but one is the potential impacts from an event, and then the other is frequency or likelihood of an event. And when we look at that, we come up with this list with earthquakes as number one. That's kind of an example of how the potential for really widespread impacts can bump something up to the top, even though the frequency of those events is maybe less than some of the other things on here. I think our current situation with COVID, however, is a good reminder that any of these things can happen at any time. While we're looking at some probabilistic numbers in terms of the likelihood that they'll happen, any of them could happen on any given day. And COVID is a good reminder of that, as well as some of the more social unrest things that we've been seeing recently. Next slide. So first, I just wanted to give kind of a current situational update and some outlook on some different things. In terms of COVID, you see the graph there is taken right from the King County dashboard. You can see kind of the grayed out area there toward the end. This goes up through June 29th. We are starting to see increases in cases. So to put it quite simply, I mean, if you look at that orange graph, you can see it going down until early June, and then you can see, some things starting to come back here at the end of the month. So we're currently in phase 2 in terms of like reopening. And what that means is not required to stay at home, but still strongly encouraging people to stay at home. Recreational activities involving 5 or fewer people outside the household are allowed. But the recommendation is that you gather with no more than 5 people outside your household per week. And then the mask requirement went into effect June 26th. So really requiring people to wear masks when they're out in public, when they're in public places like stores, And even when you're outside, if you're not in a position to be able to appropriately social distance and be 6 feet away from others. So that's kind of where we're at right now in phase 2, but again, starting to see some numbers creep up due to the increase in activity. Next slide. So in terms of outlook, you know, there's a lot of projections that exist out there, but I'll just reference one, which, you know, came out of the UW Institute for Health Metrics and Evaluation, and they're predicting a second wave potentially in September. I think what we're seeing now, most people agree, is not a second wave, it's just a continuation of a first wave. So a lot of this is going to depend on people's behavior in terms of what happens with numbers, whether we see things go down and then back up, or we just keep seeing them go up from here. So projected case increases could be significantly less if we're able to maintain social distancing. So the potential impacts from that are just, you know, if case numbers begin to go up again, we could see a reversal of phases. So we could go back to stricter social distancing, back to a stay home, stay healthy order, where it's really just essential travel and essential errands that are, you know, getting people out of the house. Next slide. So now I just want to give a quick outlook on extreme heat. Heat is, I think, a type of event that we have on our list there and we talk about in our Shiva, but I think that generally speaking, the public tends to underestimate the impact of extreme heat and the potential impacts that it could have. And they're very, very real, and they're especially very real for more vulnerable populations, especially older adults living in our community. Extreme heat is actually the most lethal weather phenomenon in the US. So on average, each year in the US, we have around 600 people that die due to heat-related illness. So year to year, it is generally the most lethal weather phenomenon that we're dealing with. In terms of the outlook this year, there is an expectation of above normal temperatures in July and August. So you'll see that map there on the right with kind of a probabilistic outlook for the next 3 months. And you'll see that dark red, especially on the kind of southwest to west coast, including Washington. So we are expecting above normal temperatures. Today would not be an indication of that. This is kind of like January and July, but I wouldn't take that as being a trend for, you know, the next month or two. And so when we have those high temperatures, the impacts that we would expect, especially when we have high temperatures over several days, and we say that, we're probably looking at 90s and above. So if we have sustained temperatures of 90 and above for a few days, that's when we start to get concerned. And it just really increases health risks to people and pets, and it has the potential for serious illness and even death, as I mentioned. And just some kind of historic events, again, when people don't really see it as a large threat. I mean, there have been significant events in the country and throughout the world. So 2003, there was a European heat wave where they had 8 consecutive days in parts of Europe where temperatures were over 100. They estimated over 14,000 heat-related deaths in France alone and 70,000 deaths across Europe. And then similarly in Chicago in 1995, there was about a 6-day period in July where temperatures were in the 90s or above for 6 straight days, and it wasn't cooling down a lot at night. And they estimated over 700 people died due to heat in those 6 days. And in that case, it was mostly older people, and especially older people with low incomes who were isolated and didn't have a lot of family. And we'll talk about that a little more when we talk about some preparedness steps people can take, especially just having the ability to reach out to neighbors, reach out to family and help them. Next. So then wildfire smoke is the other thing that is concerning to us. We'll talk a little more in a minute about kind of where these things stack on top of each other in terms of what is the biggest risk. Generally speaking, heat is a bigger risk because there's potentially very acute impacts for people. And, you know, basically they can lead to death, they can lead to severe illness just in a matter of days. Wildfire smoke can cause that, especially people with underlying health conditions, but it can also lead to more long-term issues with prolonged exposure. In terms of outlook, we're also expecting above normal wildfire potential for July and August. There's the July map right there, and you'll see the red is not over Seattle, but it's in eastern Washington, parts of Montana, Oregon, California. And a lot of our exposure to smoke comes from fires in these other areas. So just because the red is not directly over kind of western Washington, that's not so important. Typically, we've been impacted by smoke from fires in eastern Washington, also western Washington, but a lot of eastern Washington, British Columbia, Oregon, and California. We've even had impacts from smoke as far away as Siberia. So it's not necessarily the things happening right here, but happening elsewhere. Hey, I think if you click again, there'll be another map. Yeah, so then you'll see August. It's just, if you want to go back. Yeah, so you'll see the August map there. The red has expanded. So it's just more areas of Washington and Oregon, especially. And I don't have the Canada map on there, but there's similar risk for Canada and Alaska this year, which fires in those places would impact us. So you'll see Western Canada is also above normal for July and August. So the impacts from that, smoke can cause wheezing, coughing, shortness of breath, headaches. It can also increase the severity of symptoms of people with COVID. So this is where we start to see that interplay between some of these summer hazards and our ongoing pandemic. And then the big concern is people that have existing lung, heart, or circulatory conditions are going to be especially vulnerable to smoke and can have those conditions exacerbated by exposure to smoke. And we'll talk about that a little more too. So here, you'll see just some information on how these risks overlap. So there are certain populations that are at heightened risk for all of these things, for heat, smoke, and COVID. So if we end up in a situation when we have extreme heat and we have smoke and we have an ongoing pandemic, then there are going to be people that are especially vulnerable. So that means older people, low-income people who may not have access to healthcare or limited access to healthcare, and people with existing cardiovascular conditions and respiratory conditions. Wildfire smoke is a respiratory irritant, so it can actually make people more vulnerable to being infected from COVID. And we've had a lot of conversations with our colleagues in public health over the last couple of weeks. And this is one that they're highlighting a lot. I mean, if you're exposed to smoke and you're having issues with that smoke, it could actually increase the chances that you are infected with COVID-19, and then it can increase the chances that you're going to have a more severe case of COVID-19 and have some more severe symptoms because you have both of these things going on at one time. The map on the right there is just showing kind of some heat island and surface temperatures throughout the city. This was data done in 2014. We haven't done a new study more recently, but it's just kind of showcasing the fact that, you know, while Seattle isn't that large, when we have high temperatures, there are going to be areas that are experiencing even higher temperatures. And a lot of this is going to have to do with geography. So if you look along there through kind of the Duwamish Valley there, just sheer geography and weather patterns can make it hotter certain places. And then also because of the built environment. So some of those areas like in the Duwamish are going to have less green space and are going to have a lot of concrete and a lot of buildings, and that's going to lead to increased heat. If you looked up toward where like Discovery Park is, you see that's a lot cooler than everywhere else because it's kind of the opposite effect. There's a lot of green space and there's less built structures and concrete and things that are kind of radiating that heat and keeping it there. All right, next. All right, so this is, before I go into some of the specifics between around heat smoke preparedness, just want to highlight some things that are different this year. I already touched on this, but with wildfire smoke, it is just going to create additional risks for people either with COVID-19 and worsen symptoms, or potentially make people more susceptible to getting COVID-19. The other thing is access to public spaces. So I'm going to talk about some of our city planning efforts. Usually when especially we are in extreme heat events, our first strategy is to encourage people to go to public spaces that have air conditioning. I've seen varying estimates on the number of households with air conditioning in Seattle, between a third to a fifth, but I think we all know that most people do not have air conditioning in Seattle. It's just historically, temperatures are not warm enough to justify people, having central air. So we've always listed out libraries and community centers and the spaces that do have air conditioning so people can go to those. But that's not necessarily going to be a strategy that we can employ while we have an ongoing pandemic, and I'll talk about that in more detail later. So people at risk from COVID-19 are more likely to remain in their homes to avoid exposure. And then similarly with heat, if we can't provide spaces to go elsewhere and we're already encouraging people to go home, there's just going to be more people probably needing to remain in their homes. And this is just going to increase people's vulnerability as they're having to be isolated. And that's where that kind of guidance on helping neighbors comes in. The other big thing is masks. So cloth face coverings are not effective for wildfire smoke. So most people at this point are wearing cloth face coverings for COVID-19 purposes. That is not really going to protect you against wildfire smoke. Typically, the guidance has been that you need an N95 mask or respirator that is actually fitted to your face properly. The problem with that is those masks are now needed by healthcare professionals because of the ongoing pandemic. And so we don't want to recommend people get those masks unless they explicitly need to per their healthcare provider. So that's a real difference in messaging this year. Next. All right, so then just to kind of give a feel for how we're looking at this from a city kind of planning perspective, and I'll try to make sense of everything that's here. As I mentioned, normally for heat events especially, our first go-to would be telling people to go to public places with air conditioning, or if there was some need, opening public places specifically for people to get out of the heat that have air conditioning. Similarly, for wildfire smoke, during 2018 through 2019, so we had relatively bad fire years, which I'll show some stats on in a little bit here, in 2017, 2018. One of the things that led us to doing at the city was establishing some clean air spaces and increasing air filtration capacity at some buildings at Seattle Center, at the Rainier Beach Community Center, and at the International District Chinatown Community Center, with the idea that those spaces could be used for kind of clean air spaces where the public could go to during poor air quality days. The problem now is that there is more risk from COVID-19 in terms of bringing people together in a congregate setting than there would be from exposure to heat and wildfire. So working with our partners at Public Health, we've kind of come up with this list in terms of hierarchy of risk that's going to kind of drive our city response. While we are in phases 1 and 2, and we're currently in 2 right now, COVID-19 poses the greatest risk to the public. So we would not move to encouraging people to go to congregate spaces for clean air or to get cool, because the risk of bringing people together in a space in terms of COVID exposure is greater than the risk posed by heat or wildfire smoke. Now, as we move to phase 3, and we would only move to phase 3 if we can show that we have, a low enough level of community spread, that would change a little. Heat then would be a greater risk than COVID, because we would only move to phase 3 if we had reason to believe community spread was low enough that there's probably less risk in those congregate settings, because in phase 3 we would be able to have gatherings of 50 up to 50 people, as opposed to our 5 people right now. And heat would be more risk, because what I mentioned, heat is there's just an acute risk that people can fall ill and people can die from rather kind of short-term exposure to heat. Not until we move to a phase 4, which is almost a complete reopening, and events over 500 people or events over 50 are allowed, and there's few restrictions out there in terms of movement and gathering. Only then would it make sense to also open clean air spaces, because now the risk from wildfire smoke would even be greater than the risk from COVID. So in phase 4, if we were to have an extreme heat event, we may move toward pushing people to encouraging people to go to public locations with air conditioning or opening up separate places for that. Or we may do the same thing for wildfire smoke if we had poor air quality days. So that's only when we get to phase 4. So hopefully that makes sense. It just significantly changes how we respond to these events compared to normal years. Next. All right, so just some quick things on what response looks like to extreme heat. One of the things that we do in the Office of Emergency Management is, all of our staff are rotating through staff duty officer, and we're kind of the point person for things that require coordination throughout the city, things that go beyond a single department. And one of those things could be extreme heat. And we have some checklists that kind of guide us in that. So some of the triggers that we're looking for any advisory or statement from the National Weather Service for the potential for unusually warm conditions in the Seattle area. We're actually working with them right now. They're kind of coming up with a new product specifically around air quality and around heat, so they can provide us some kind of detailed forecasts for the weeks ahead, so we know something might be coming. We're looking for increased reports of heat-related illness. So we'd be talking with our partners in public health, Seattle Fire Department, other responders throughout the region, 211, our customer service bureau, media reports, just trying to gauge, are we seeing more heat-related calls for assistance? And then number of hot days. Hot is kind of general there. Like I said, we're usually paying attention when things are above 90 and it's sustained for a few days, but also when things aren't cooling off in the evenings as much for some consecutive days, then that's a concern. And then infrastructure impact. So if we start seeing increase in fires, if we start seeing utility outages due to heat, transportation incidents, then that's something that's going to put this on our radar and probably make us start. Any of these things are probably going to make us start pulling city departments together and other partners to talk about what actions we need to take, if any. And those actions would be starting to put out more public messaging on what people can do to stay cool. Like I said, normally without COVID, or depending on what phase we are in, that could include sending out lists of city facilities that are open and have air conditioning. Usually that's libraries, community centers. We would be looking to assess the impacts to vulnerable populations, so especially older adults, and that's something we would do through our Human Services Department and other agencies. Their Human Services Departments, Aging and Disability Services, who are serving elderly clients, start doing some things to check in on clients and kind of gauge impacts. Reviewing planned events in the city. So we'd have to start looking at, do we cancel permanent events because the heat outlook is just such that it's not safe to have people outside for prolonged periods of time, and we'd have to make decisions on that. And then while COVID is still a threat, and while we're in phase 1, 2, 3, it's really working with our partners at public health to determine at this given time, right when this heat is happening, does it make sense to open congregate cooling centers? Or is the risk from COVID greater than the risk from heat? And while we put those guidelines up there in terms of what phase we're in, there's always going to be some subjectivity in that. And depending on how extreme the heat is, it's really going to be kind of a game time decision in talking with public health and our local health officials about what makes the most sense. All right, next slide. So just in terms of actually preparing for heat, thank you to Melanie on our team for the hot tips from a cool penguin. If you can't tell, he has a mask on, so this is a very prepared penguin that we have there. Some things to keep in mind, the basic things are limiting exposure to the sun. So if not going outside and being in the heat is really your first defense, drinking plenty of fluids and making sure you're replacing fluids, salts and minerals, dressing in lightweight clothing as much as possible, spend time in air conditioning if you have it or you have access to it. One of the things in terms of working with neighbors that you can do is if you have air conditioning, letting people come benefit from your air conditioning, but trying to stay within those social distancing boundaries that are in place for whatever phase we're in, and wearing masks and avoiding physical contact and keeping a distance of 6 feet. Just avoiding strenuous work outdoors, exercising, things like that are just going to kind of exacerbate the heat. And then using sunblock as well. Covering windows in the morning and afternoon. I have just from my own experience learned how effective this can be. If you have windows open all day and you have the sun blaring down into your house, it's just going to heat up and it's going to be a lot harder to have it cool down. So covering windows in the morning, afternoon, taking cool showers or baths, or even just having a cold washcloth and ice that you're putting on your body, that's a big one. And these are the ones that you can really help neighbors and family members put into place, because they're simple things, but a lot of times older adults that are home alone, they're suffering from the heat, but they're not necessarily taking some of these actions. They're not drinking water, they're not taking steps to keep themselves cool. So how can you help other people do those things? Avoiding drinks with caffeine and alcohol and large amounts of sugar. This can be a tough one. We all want our coffee, and on a nice summer day, we also want our alcoholic beverage, but just being smart about how you do that and making sure you're drinking plenty of water and staying out of the sun too. Doing outdoor activities in the morning instead of doing them midday is a simple thing you can do. And then just to highlight again, checking in on elderly neighbors and relatives on a regular basis to make sure they have what they need. The people at highest risk, and we'll talk about, it's very similar with smoke, it's older adults, it's infants and young children, and people who are really doing hard work outside, and people that might be on certain medications that might make them more susceptible to the heat. Can you hit next? I think there's another, maybe again. And just, I referenced the Chicago heat wave of 1995. If you're interested in a good book, Heat Wave is a very good book that documents that heat event. And a lot of what it focuses on is just the populations that were most impacted, and that being especially low-income seniors and seniors that were isolated. So a lot of focus on people that had no family, and they didn't have regular contact with neighbors or with family. And so, they remained in their apartments. Most of these people were in kind of the inner city in multifamily housing where temperatures were going to be even higher because of some of those heat island effects that we talked about. And just not doing those simple things that we talked about, like, taking a cool shower, putting a cold washcloth on you, and staying hydrated. So if you have people in your life that or even that are near you that you don't know that well, it's a good time to get to know them, so you can be the person checking on them and making sure they are doing those things or helping them do those things. All right, next. All right, so now I'll just talk a little bit about the city response to wildfire smoke, those triggers and actions. So similar to heat, but there are some differences. We're going to be looking at the air quality forecasts, and I'll go over kind of the levels of that in a minute here. But really, when it's in the categories of unhealthy for at-risk populations and unhealthy for all, that's when we really start to get concerned. If we see increased reports of air quality related impacts, so same that I said before, increased calls to Seattle Fire, checking in with our partners at 211. If we're starting to see more respiratory things come in, then that tells us, something's going on. Combination of poor air quality and extreme heat days. So again, if we have both of those things working together, it's just going to be even worse. And a lot of times they are going to coincide because the more extreme heat we have, we could see more fires and then we'd have more smoke. And then shelter bed availability nearing capacity. So looking at city and county shelters that are serving homeless populations, we don't have this on our heat checklist. And the main reason is that temperatures, especially in the Pacific Northwest, typically cool down at night. We may look at this for heat if that's not the case and it's not cooling down, but most of our shelters are really overnight shelters where people are not at during the day, but they're coming just for overnight. And typically we're seeing temperatures go down. Air quality, however, is not going to change overnight. If we have poor air quality, it's going to be poor in the evening and poor during the day. So then we get more concerned about people having exposure all day and night long, and do we need to expand shelter capacity? So similar in terms of actions we start taking, disseminating public messaging. How can people stay safe? Are there locations they can go to with better air quality? What are things that they can do at home to make better air quality? Assess impacts and needs of vulnerable populations, like we said, through our Human Services Department, probably through our navigation team and the homeless outreach that's happening in the city, gauging impacts to that community. And then similarly, reviewing planned events to see if there's things that we need to cancel or alter in terms of permanent events, because air quality is just such a concern for people being outside. And then again, similarly, while COVID is a threat, it's again making that calculation of what is the bigger risk at the time. As you saw in that hierarchy of risk slide, because wildfire for most people is more of a prolonged exposure issue, it's really not until we're in phase 4 probably that the exposure to wildfire smoke would be a greater risk than the exposure to COVID-19. But like I said, that could change depending on the situation and consulting with public health. All right, next. So preparing for wildfire smoke, I already referenced this, but it's just good to know who is most vulnerable. Babies, children, young kids, people over age 65, people with existing health conditions, so especially cardiovascular disease, heart disease, respiratory problems, asthma is a big one, and people who are pregnant. So all of these groups are going to be just more vulnerable to wildfire smoke than people who are not in these groups. Next. And then I'm just going to talk about kind of some of these steps, and we'll go through them in more detail, but generally what we're talking about is being aware of what the air quality is, and we'll show you some tools for that. So you know if it is safe to be outside or if it's getting to that point where maybe it's not safe to be outside. Limiting outdoor activity when the air quality is poor, so staying inside, and then really taking steps to be able to keep the air clean in your house. And during COVID, this is especially important because we may not be able to provide places with clean air that people can go. So what are the steps you can take to keep the air clean in your house? And if you think that you potentially are more vulnerable to wildfire smoke, you really need to talk with your healthcare provider about that and have that conversation now. And mention the mask issue, and that's going to be a big one. I mean, if you need to go outside and there is poor air quality and you are in one of these vulnerable groups, then you may want an N95 that's fitted to you, and you really do need that, but you want your healthcare provider telling you that you really need that and helping you to get the resource that you need. Because really those things at this point, due to COVID, we're prioritizing for healthcare professionals. But if you need it, you need it. It's just best to work with your healthcare provider to figure that out. Next. All right, so knowing what the air quality is really the first step. And this chart here comes from our partners at the Puget Sound Clean Air Agency. So the tools that I point you to in terms of knowing what the air quality is on any given day, they're going to use these colors and use these terms. Green is good. Today it is good. If you went and looked at the air quality index, when it starts to get to moderate, then maybe we start to pay attention. We really get concerned when it gets into the orange, red, and purple there. So the orange is that unhealthy for sensitive group. So kind of those people that I mentioned that could be more vulnerable. That's when it becomes a concern for them. And then the red, it's really everyone. It's like we don't want anyone doing things outside if they don't have to, because there could be serious health effects from exposure. If you want to hit next. Oh, go back. Oh, go back. One more. I'm trying to get to that one in the middle there. Then there's a next image. Yeah. So this first resource, this is just a screenshot from the Puget Sound Clean Air Agency website. So we have that right there, and it's listed on the resources document that's there in the Q&A box. Like I said, today it's green, but if you go to their homepage, this is what you see. You have to just scroll down a bit, but you'll see this King County. Okay, this is what we're looking at, and you'll see other parts of the state listed there that you can click on as well. But this is going to tell you, healthy adults, what's the risk for you today? Sensitive groups, what's the risk for you? And I think they've done a good job at having some pretty straightforward, it's green with a thumbs up. So again, if it starts to get to that yellow, orange, red, then that's probably when you want to be concerned. If you hit next, and then again and then this screenshot comes from the Epa Smoke Sense App. So this is if you're looking for an actual app to have in your phone that you can quickly check and have it set up so it's telling you or giving you a notification when it gets to a certain level. This is a good one to have. And actually this one's pretty cool because you can also do some actual reporting of what you're experiencing that then the EPA uses to kind of tweak some of their data or just get feedback on, whether people's experience and what their experience in terms of breathing and coughing and things maybe doesn't match up with what the air quality rating is. So in there, you can kind of go through a questionnaire for the day and just give some feedback on what your experience is with the current air quality, in addition to just getting this quick kind of meter reading of what the air quality is where you're at. So that's pretty cool. Next. So just in terms of information, I mean, those are your kind of primary resources for information on air quality, but I do highly recommend being on other alert systems. So like Alert Seattle is our official emergency alert notification system for the city of Seattle. You can sign up at alert.seattle.gov. We also have some COVID specific messaging that goes out weekly that you can sign up for just by texting COVID Seattle to 67283. But when you sign up at alert.seattle.gov, if you go that way, health related messaging is something that you can specifically choose to opt into. And I think in both 2017 and 2018, we did use Alert Seattle for the purpose of air quality messaging to people if they'd signed up for those health related alerts. So that's a good way to make sure you're getting information from us, because if we are pushing stuff out about what city facilities are open for cooling or things like that, we would use that. Next. And then just looking at other sources of information, I mean, Alert Seattle, but just knowing what radio stations to tune into, social media, I mean, following news sites and city departments on social media, and then knowing where your nearest community emergency hub is. So If people aren't familiar, hubs are locations in the city that really, for the most part, have been defined by community and are places for community to share information and share resources when city resources are overwhelmed. I think for the most part, this probably wouldn't be a go-to during heat or smoke events, especially since we're probably not telling people to go to a physical location. A lot of hubs are located outside, but I think it's good to connect now because they could be standing up in some fashion or sharing information electronically in these situations. And then just in other situations, you know, if we do have that earthquake or something else, then there could really be a need for that kind of neighborhood level coordination happening through the hub. So just getting familiar with where they are now and getting involved with them now is a good idea. Next. And then just think about other regional alerting systems. So, you know, not everyone lives in Seattle, and some people live in Seattle but regularly travel to other places or vice versa. So there's Alert King County, there's Pierce County Alert, Kitsap County Alert, and Snohomish County Alerts, just to name some of the ones right around us. Snohomish County Alerts, they use the same kind of back-end system as Seattle. So if you download on the right there, the Smart 911 app, you can download the Smart 911 app and through that app also sign up to get notifications from Alert Seattle and Snohomish County. When you do the Smart 911 app, you know, you can get alerts, but you can also put in information about household members. And I think this is a really good one too, to encourage people, especially who might be having to isolate at home, social distance, who are older, to have a Smart 911 profile. You can really put as much information as you want in there, kind of key information about people living in the house. You can give them unique location information. I've had good examples of people kind of calling our office with issues like, you know, they have a heart condition, they've had to call 911 before, they feel like it's very likely they might have to call 911 again in the future, but their concern is their actual physical address, if you were to map that, takes you to the front of a building when really they're down an alley and behind the building is where their door is. So they can put that kind of information in the system. So if they call 911 from the number they have registered, that kind of stuff comes up, as well as information on existing health conditions that might be important. And you can really add as much or as little as possible. You can get down to adding stuff about pets and what vehicles you have and things like that. Just one kind of caveat, you need to put it you need to list a Seattle address in the profile for it to give you the option to add Alert Seattle alerts. And similarly, if you also wanted to add Snohomish County, you'd have to put an address there, which is kind of a weird thing about it, but you can put as many addresses as you want in your profile. So just an extra step, but something you might want to think about doing. Next. So, you know, the next thing we talked about was really how do you keep clean air in your house? You know, you want to avoid going outside, but if you're not doing anything in the house to clean the air quality inside may be just as poor as being outside. If you have central air in an HVAC system, it's just making sure that you have a filter that really is the highest designated rating. So a high efficiency particulate air rating, or HEPA, which is usually, it's going to be like a MERV 17 through 20. That will be like the rating it has on the filter. So if you have something that says HEPA or MERV 17, 18, 19, 20, then that's going to be a good enough filter to really substantially decrease the particulates from smoke that are in the house, up to potentially reducing them by 95%. So if you don't have central air, which, like I said, most people in Seattle don't, it's really important to designate a room to be a clean room. So making sure that you don't have windows open, you keep doors closed, to keep smoke out as much as possible in that room and spend as much time in that room as possible. And then in that room, you would want to have a portable air cleaner. So kind of a store-bought portable air cleaner can be expensive, I will tell you that. When I looked them up for like the rating you would want, they probably range from $300 to $700. The things you want to make sure is We have the link to this guide to air cleaners in the home in the resource document, but one of the things this provides is kind of a little table that shows what they call the clean air delivery rate, or CDR. And basically every air cleaner will have a clean air delivery rate, and that matches up to a square footage of a space that it could effectively clean. These are typically going to clean a single room. So if you have an air cleaner, in your living room, it doesn't really mean that you're giving yourself clean air in your bedroom. So that's where it's kind of designating a space to spend time when there's poor air quality. One of the big things is making sure that it is a California certified device. So the California, I think it's the California Air Resource Board, they basically designate certified devices, and a lot of that is based on the ozone output. So some of these air cleaners can put out ozone molecules, which are very harmful to the environment. So while they're providing you with clean air, they're having other harmful long-term impacts to the environment. So if it's California certified, then they're certifying that it's a low enough level of ozone that's put out that it's okay for you to have. So that's something you'd want to check. And like I said, that's in the resource list there. All right, next. Your other option is to build one for a lot cheaper. And really all you need is a box fan, which a lot of people already have a box fan, and then you can buy a separate filter that you want to be a MERV 13 or higher. It should be easy to find a MERV 13 filter. We'll show you the video here in a second, but it's basically the same size as the box fan. It's what the guy's holding there. And the MERV filter is about $20. If you already have a box fan, then you just need to spend the $20 to get the MERV filter. In the resource guide, I put a couple of links. One to this video. This guy has a white coat on and a machine that measures particles, so he seems very trustworthy. He's also doing a very easy. He's doing this in a very easy way. He's essentially taping the filter to the fan, which you can do. The second video that I provided a link to is through Puget Sound Clean Air Agency. It's the same concept that they show. It's just a little more complicated. They kind of screw on brackets and then slide the filter in, which is a nice permanent way to put the filter on there, but tape works just fine. So we're gonna try to show the video here. The general consensus is, and I've seen a number of these videos and measuring the particulates, I mean, with the HVAC filter or one of those high-end air cleaners, you can reduce particles by up to 95%, but really with this method, taping the filter to a fan, you can reduce them by as much as 85%. So let's see if we can show the video. Might take us a second. I also have a fly coming in front of my face. While we wait for the video, I mean, people can, if there's any questions, feel free to put them in the Q&A. It looks like maybe we have some, I don't know, new questions maybe. I don't seem to be able to scroll on the questions. I don't know if anyone on the OEM team that's on the back end can see the questions in the Q&A thing. I see that there are questions, but I can't see them.
Hey, Matt, this is Carrie.
Yeah.
We have a question about, give me a second here. Someone asked if it's being recorded.
Yes.
Okay. And if we could potentially send that out to the attendees.
Yes, we can do that. We'll probably put it on our website or YouTube channel, and then we'll also email a link to it to people
Okay.
that registered.
And the next question is, how about people with blindness? What is the smoke limitations?
With blindness, was that the?
Yeah, I didn't get any other detail.
Yeah, I would maybe need some clarification. I don't, you know, I'd have to look back, and we put some links in there to some more detailed guidance from public health and things, but it's really, I mean, it's really people with existing respiratory conditions or older folks. I don't know of any specific impact there would be for blind individuals.
And that's it so far.
Okay. Any video progress, other folks, or can we go back to the?
Cubic foot. You've seen the high-end filter system now and what it can do. It's incredibly powerful, but not everyone can afford a $600 or $800 HEPA system. So there is something that you can do to filter your air in a bedroom, for instance. And this is something that you can put together with pieces from your hardware store. And what I've got here is about a $12 to $15 20-inch box fan and a HEPA filter that you can buy for a furnace. So this is a 20 by 20-inch HEPA filter. And it's important that you recognize that it comes in different levels of filtration. So a MERV 13 filter is a very highly rated filter that'll get a lot of very small, those 0.3 micron particles out of the air. So this can simply be done by putting the filter in front of the box fan so the air is blowing through the filter. And I'll just tape this filter here. You can see there's a direction for the airflow marked on the side of the filters. You'll see if you look at yours carefully. And now I'll take the same counter and count the particles coming through the system. So our ambient count again is about 400,000, and I'll turn the fan on and count the particles, and we'll see how they drop. Typically, this MERV filter will cause about a 90% reduction in those small 0.3 micron particles. It measures every 6 seconds, and you can see I've gone down from 400,000 to 54,000. It'll probably hover around that point. So this $25, $30 system is filtering 90% of the particles out of the air. You'll probably want to put something like this in a bedroom, for instance, where you sleep and spend a good part of your day to filter those particles out of the air. If you want, you can put them in other areas of the house as well.
Right. So you'll see, I mean, it is very simple. I'll tell you, you can find a lot of videos showing that same thing. What you'll find is you'll find two different approaches. So you'll see people that put the filter at the front of the fan and others that put it at the back of the fan. To my knowledge, it does not make a difference, but the filter will usually have arrows around the edge of it saying airflow this way. So if you put it in the back of the fan, you know, you just want that pointing toward the fan because the air is going to come through the back of the filter and then through the fan. And if you put it on the front of the fan, you want it putting away from the fan. So you want it, you know, whatever way the air is going to be coming into the filter, you want the arrow pointing away from that. I realized something I forgot to mention about heat. The other thing that's a little different this year is everyone is being asked to wear a face covering. But if we have extremely hot conditions and humid conditions, then wearing a mask or a face covering can be problematic, especially for people that may be prone to asthma or other things, but really for anyone. I mean, it's just going to be more difficult to breathe if it's 90 degrees and humid and you're wearing a mask. So in those cases, it really is back to the guidance, just like strenuous activity and things like that. I mean, stay inside as much as possible and don't go outside. So if you're practicing social distancing and you're not going out into public places and you're staying at home, then you don't need to wear your mask. So then you don't have to worry about that. But it is something to think about. In extremely hot days, if you're then going outside while we have a pandemic and you have to wear a mask, it can just create more problems. You hit next, okay? So then here's the filter. So just the other thing to keep in mind with the filter is you have to change the filter probably every 3 months if you're regularly using this fan and filter method. And if you're using it, I mean, you want to make sure it's, again, in a space where windows are closed, doors are closed, or you're not really solving the problem. And then you just see the before and after there. That's after about 3 months of use of the filter. So 3 months is a good guide, but also just look at the filter. I mean, it's going to start filling up with dirt. You're going to be able to visibly see that. All right, next. So then just some other things to keep in mind. I mean, connecting with neighbors. So, I mentioned this is really important. There's people that are going to be more vulnerable. There's people that are already isolated and, self-isolating because of COVID. So how can you reach out and help them? We have existing things through our office and that we work with, like the hubs. We work with the hubs, and that's one resource that kind of connects you with neighbors. SNAP, that's our program focused on kind of block level or building level preparedness. So those are things to think about, especially from kind of that broader, how do you connect with neighbors now in preparing for emergencies? There's also some very COVID specific things. So if anyone uses Nextdoor early on during the pandemic, they launched their help map. So if you're on Nextdoor or you can get on Nextdoor, there's a tool on there to really offer help to people, saying what you could help people with, getting groceries, running errands, things like that. Or people can put on there that they need help with things. So then you can see who needs help and offer to help them. AARP similarly launched a community connections tool that is the same thing. It shows kind of mutual aid organizations, so seniors can reach out if they need help and connect with organizations via that. And then there's been a lot of neighborhood-based tools that have come up. I know in West Seattle and Southeast Seattle and some other places where websites have been stood up for the purpose of really connecting people with neighbors that can help them and organizations that can help them. Next day. And that's just a screenshot of like the Nextdoor map that's available there. So it's just a, really you click on the green dot and it'll tell you what that person needs or, what that person's offering. So it's a good way to connect with folks. All right. And then here is a document that we we put it on our website today. So the impetus for this is really COVID, but I think it definitely applies with heat and smoke as well, as we've been mentioning. So you can get this on our website. We're going to be printing them in the next couple of weeks and hopefully distributing them to a lot of locations in the community, grocery stores, and anywhere else we can get them. But this is a good tool where if you don't already have contact information for neighbors, then you can use this, put it on someone's doorstep, put it in their mailbox, slide it in their door, just saying, hey, this is who I am. This is where I'm located. Here's how you get a hold of me, and I'm happy to help you with any of these things. Check what you want to check. And then there's a nice reminder on the back of how you can safely do that. We still want to maintain social distancing, not have physical contact if we can avoid it, wash hands frequently, wear a face covering. And then if you're getting groceries or things like that, leave them on the doorstep. Don't have physical contact. If you can, exchange phone numbers, emails, social media accounts, then you can communicate that way. And if you need to do something in person, then it's just keeping that 6 feet distance while having your face covered. So hopefully people kind of find a good use for this tool. We have this on the website. It's listed in the resource document there. And eventually we'll have it in 13 languages. I think I currently have 6 or 7 languages in addition to English that are uploaded to the website right now. Next. And then here's just some COVID specific information. just making sure that you're getting things from good sources. So our good sources are always going to be the CDC, the Washington State Department of Health, Public Health, Seattle King County, and the City of Seattle. Like I said, you can text COVID Seattle to 67283 to receive updates via Alert Seattle, and you can sign up for public health email updates at that link there. Next. And so a lot of our traditional messaging, especially when we're talking kind of earthquake context, which we do a lot, we talk a lot about supplies and things that you need to have on hand. So just worth mentioning here, I'm sure everyone remembers the great toilet paper crisis of 2020 at the beginning of the pandemic. This is an actual shot from a grocery store in Seattle in the toilet paper aisle. We're always encouraging people to have what they need for 2 weeks. Have toilet paper, have food, have water, have extra medications. So in the event that things are closed or transportation's disrupted in something like an earthquake, you have what you need. In the case of COVID, we had a lot of calls with grocery stores, both at the state level and at the local level at the beginning of the pandemic. And the general consensus is that we did not have a supply issue, we had a demand issue. So people were doing some sort of panic buying, buying much more than they needed, anticipating that they wouldn't be able to get it at some point, which was kind of a self-fulfilling prophecy. But it's a good reminder to do that now while we're in somewhat of a normal state, to make sure you have what you need for 2 weeks, because if we do have heat, if we do have smoke, if we do revert back to some stricter guidelines on social distancing, then you don't need to worry so much about going to the store and just exposing yourself to these things. You have what you need. So just thinking about what you need on a daily basis and making sure you have those, and having some basic things in your car and at work as well, because things might happen there. I got a bidet. That's how I dealt with the toilet paper crisis. So you could also go that route. Next slide. And then I'm just going to close with some COVID reminders. I mean, we talked a lot about things you can do for heat, things you can do for smoke, and how that might be different during COVID and while we're still having COVID present in our community. But I think we've all seen people getting kind of lax out there. So it's just a reminder that all of these things still apply. Wearing a face covering is technically required now. So wearing a face covering, washing hands frequently. I think there was a hand sanitizer crisis at the beginning of the pandemic too, but sometimes people forget, soap and water is just as effective. So washing hands or using hand sanitizer, maintaining social distance of 6 feet or more from people. And then if you're experiencing symptoms, get tested. And that's really big right now because, public health always wants to be better tracking what the actual impact is in our community. And that gets done by testing. So you'll see all of the symptoms there. I won't list them all out. I think mostly we think about cough and shortness of breath because it's really a respiratory issue, but there's a lot of other symptoms and people don't always have all of those symptoms. So if you're experiencing any of those, or that you've been exposed to someone that tested positive, then you really do want to get tested. And we have the link there to the city site where we list all of the free testing sites that are currently operating in King County and within the city of Seattle. So if you're experiencing any of those things, make sure you get them. Next, and then just if there's any more questions, do I see here? I'm not sure of your question, Carrie.
Okay, thank you. There's a question for the document website. Are you adding Farsi language too?
I will say it is not in the plans right now, just because Farsi is not one of even kind of our top 2 or 3 tier languages in Seattle. I think it is in King County. It's not something we typically translate in. If we knew there was a desire for it and someone that had groups that they wanted to help get it out to, then we could definitely look at doing that. And I can And if someone did want that and to work with me on it, I could always, they could reach out to me and I can put my email in there.
Okay, and that's it.
All right. No other questions? All right, with that, I mean, hopefully people, you got the, we gave the link to the PowerPoint, we gave the link to the resources document, and then we'll take the recording from this. We will post it online and we'll email the link to folks who registered. But otherwise, you'll be able to find it on our website and our YouTube channel. So thank you very much for joining us. And I did put my email in there, so if there are other follow-up questions on anything, people can feel free to reach out. All right. Thank you.